Great. Welcome, everybody. This is very important work. I appreciate Commissioner Swanson heading up this task force. This is a model that's worked very successfully for us. I want to start just by going around and doing introduce yourself, just name and title and affiliation. And then I have some opening remarks, and then I'll get out of your way and you can get to work. So, Ed.
Thank you, Governor. Ed Buttrey. I have a couple of different roles. I'm a representative representing House District 21 out of Great Falls, and I'm also president and CEO of the Montana Hospital Association.
Thank you, Governors. My name is Jody Etchart. I'm House Representative for House District 51 out of Billings.
Glad to be here, Governor. Representative Josh Seconder, House District 62 on the west side of Bozeman.
All right, thank you. Not a legislator anymore, but ex-legislator and the secretary of the Montana AFL-CIO. And my name is Jason Small. Thank you.
Derek Harvey, Senator for Senate District 37 out of Butte.
Good morning or good morning. Public Health and Human Services here in Montana.
Good morning, Eric Strauss, the director for the Montana Department of Corrections.
Great. We have some additional members. Why don't we go around?
Gail Constant, public member with Montana Board of Pharmacy.
Webb Brown, Montana Dental Association. I'm John Harding from Great Falls. I own a construction company there and also representing the Montana Home Builders Association.
I'm Bob Dean. I'm also out of Great Falls, and I'm here on behalf of the Montana Contractors Association today.
Tony King, I am a pharmacist. I'm here representing the Montana Pharmacy Association.
Allison Paul is a lawyer and the executive director of Montana Legal Services Association.
Good morning, I'm Amy Narrison. I'm here on behalf of the American Medical Response, which provides ambulance services throughout Gallatin and Yellowstone counties, and also the Montana Psychiatry Association.
Good morning, Kelly Lynch. I'm the executive director of Montana League Families.
Good morning, Brad Longcase here on behalf of the Montana Dental Hygienists Association and the Montana Funeral Directors Association.
Good morning, Kristen McCauley. I'm the APRN member for the Board of Nurses. I'm dual certified as a family nurse practitioner and psychiatric nurse practitioner and work a little in mental health.
Morning, I'm Troy Jensen. I'm a professional land surveyor from Sydney, a little bit east of here.
Thanks for making the trip.
And I'm here representing the Board of Professional Engineers and Professional Land Surveyors.
Morning, Jen Hensley from 6 blocks that way, so it's not quite as a stretch. Oddly, many of my clients sort of fit into this, so I'm appointed for the Montana Academy of Physician Assistants, the Montana Speech Language Pathology Association, Montana Occupational Therapist Association. Additionally, during the session, I work with Montana Optometric Association, and year-round, I work with Ability Montana, which is quite active in the disability community. And I imagine that all of those clients will have suggestions. They've already contacted me with some. Additionally, Missoula County is also be watching from the county level.
Hello, good morning. Alan Lloyd, just one entity, the Montana Society of CPAs.
Okay. Do we have some additional task force members in the back there?
We have them online, sir.
Okay. And online?
Thank you, Mr. Governor. This is Senator Mark Noland representing the Greater Flathead Valley in Senate District number 6. Grateful to be on this committee and so appreciative, Governor, of your foresight and insight to making this whole thing happen so that we can help the 406 jobs process and other things. With your great leadership, we appreciate serving on this committee. I happen to have the privilege of serving as a chair of Business and Labor.
Okay, thank you for joining us. Other people online?
Good morning. I'm Serena Brewer. I'm a family physician in Butte. I get to wear 2 hats. I'm representing the Montana Medical Association. I am also one of 2 clinical deans for the University of Washington in Montana.
Great.
Good afternoon, Stacy Anderson calling in from the nation's capital. So a little bit further than Sydney, so a little difficult to get there today. And I have been appointed on behalf of the Montana Primary Care Association. And I also have represent clients that are a tribal health department and also some physician associations. So thank you for having me.
Okay. Anybody else online?
Yes, good morning. My name is Sierra Reesberg, and I'm representing the Behavioral Health Alliance of Montana.
We should also have Representative Teal.
Yeah. Anyone else online?
Good morning. This is Representative Teal from House District 30.
Good morning. It's
Welcome.
Tanner Avery. I'm the policy director with the Frontier Institute.
Okay. That's right. Is there anybody else over here that's on the task force? Okay, great. Well, good morning, everyone. It's a very diverse group, and that's exactly what we need because this is a complicated problem. As we all know, unnecessary red tape and burdensome regulations make it way too difficult for qualified people to get to work. And Montanans who want to contribute to our economy need and deserve a more efficient system. That's why we're here today to deal with one of the most pressing issues that's facing Montana's labor market today. And my task to all of you is to develop a plan to reform our professional and occupational licensing system in Montana and make it easier for Montanans to enter the workforce. Business owners and over 100,000 qualified Montana workers are ready to enter the workforce, are counting on us to really streamline the processes in state government, and we must deliver for them. I'm proud to join you in launching this licensing reform task force. And as I noted, this is a very diverse group from really all sectors of our labor market. This is a bipartisan group and includes members from a wide range of industries, as we discussed here. And I appreciate the legislators that are with us and their insights that will help us get the ball over the finish line. I appreciate all of your experience and perspective that each one of you brings here. Each one of you has a very important seat at the table. As you know, I charged this task force to identify and recommend ways we can eliminate unnecessary or redundant licensing requirements. And essentially remove barriers to make it easier for people to get into the workforce and to pursue the American dream. So before we get started, let's take a step back and just look at where we've been. For decades, regulatory red tape has built up in our state, creating hurdles for those who are trying to enter the workforce. Every time we innovate in any industry, we always add new regulations and new training requirements, but we never remove the old ones. So we just accumulate more and more. Our economy is growing, and our licensing system is not keeping pace with the demand for qualified workers. But as we pile on regulations, regardless of industry, we make it harder for Montanans to actually go to work. So we face critical needs in various sectors, and these unnecessary requirements are standing in the way of filling available jobs. When I took office, unnecessary red tape was really out of control in Montana, and we got to work on day one. I was really proud of the work that the Lieutenant Governor has done on red tape relief, and we reviewed every regulation in every agency and have now streamlined them. Since then, working with the legislature, we've repealed or amended 3,500 regulations across the state. That means we rolled back, reformed, and repealed about 1/5 of all the regulations in the state. That only leaves us 4/5 to go. And with the help of the legislature again in 2025, we signed into law an additional 26 licensing reform bills. This is real progress. And these bills, in particular, standardized applications and processes for nearly 200,000 Montanans across 200 different licenses. But there's still more work to be done. And I've been very clear, while we've made these historic steps, we've got more work to do. The formation of this new task force is the next step in our effort to remove the remaining barriers to prevent qualified people from filling critical jobs. Specifically, we know that construction and healthcare industries are in dire need of more workers. Coming alongside the 406 Jobs Initiative, this task force will help us drive innovation and remove red tape across all of these sectors. According to DLI, we have more than 100,000 working age Montanans that are not employed and not seeking work. That's almost 10% of our population. Working age, no job, and aren't looking for work. They're just sitting on the sidelines and not contributing to our economy. While the number one issue for most businesses is they can't find qualified workers, we have 100,000 people sitting on the sidelines. So you can help us with this. We can and must tear down barriers to employment to grow our labor force. With this effort, our work must be very intentional. Our focus is on removing barriers while we protect public safety. We don't want no regulations. We just want the minimum amount that we need to ensure public safety and quality. So I've asked the task force that by September 2nd of this year, this group will deliver a final report and recommendations to help us achieve these goals. That'll give us a roadmap going into the 2027 legislative session. These reforms are essential because while temporary measures help, we need long-term changes to our regulatory environment. And I'll be frank, this is no small task. Licensing requirements are complex and vary across many different boards and industries. And it won't be any surprise, but some people prefer high barriers to entry into these industries. And I'm asking you to help us remove the ones that are unnecessary. But we're not going to kick the can down the road anymore. We're going to deal with one of the most pressing issues facing Montana's labor market. We must put an end to overregulation. We must ease the impact of redundant training and testing requirements. We must increase transparency of licensing process to make it easier for individuals to navigate. We must ensure that the qualified individuals, particularly those struggling to find a path upward, are not held back by the heavy hand of bureaucracy or protectionist policies. And we must do it all while maintaining high standards of safety and quality that Montanans expect. I'm committed to reforming our licensing system with your help, and I know you all share in this goal as well. So every day I'm focused on opening the doors of greater opportunities so more Montanans can pursue the American dream. The best way to do that is with a good job, and that's why we need licensing reform. Every day, Montanans work hard to achieve that dream, earn a decent living, and contribute to their communities and raise their families here in the state that they love. Government should not stand in the way of Montana's achieving their goals. Each of you has an important voice for the industries that you represent. And I'm glad you're all willing to donate your time to make these changes a reality. The potential of this task force will only be fully realized if you bring all of your perspectives to the table. We know this is a model that works because it's worked before. With a thoughtful, diverse, bipartisan group, our previous task forces have delivered meaningful results, and we have similar expectations this time as well. I have great confidence in all of you that we'll get a great result by September, and I'm optimistic that this group will achieve your goal to modernize Montana's licensing framework. Challenge one another, identify solutions, leave no stone unturned, and provide us with recommendations to fix the problems that exist in our current system. Give us solutions that address the barriers facing Montanans. They're counting on us, and we need your help. So I look forward to your ideas, and I'm here to be a resource whenever I can be helpful. Just as I believe government regulation should be a light touch, I believe I should have a light touch on this task force, which is why I'm going to step away and let you get to work. So I appreciate your time and your commitment to reform and your willingness to serve the people of Montana. Thank you all so much for being here.
Thank you, Governor.
Yeah. You're welcome.
All right. Hello, everybody. I'm Sarah Swanson. For those of you that I don't know, I think I have the best job in Montana. My colleagues might disagree with me to the right, but I get to serve as a member of the governor's cabinet as the commissioner of Montana's Department of Labor and Industry. And one of the many things we're responsible for regulating at the department is Title 37 and professional occupational licensing in Montana. It's a privilege to be here with all of you and convene this first meeting of our licensing reform task force, and to welcome such a broad cross-section of all of you. All of you in this room are no strangers to us at the department and the work that we do. You are fierce advocates for your industry, your licensees, and the work that we do. I'm so grateful for your help. Each of you was asked to serve because you see from different angles how Montana's licensing system affects real people and real communities, and we need your voice. So throughout this process, over the next 8 months, please speak up early and often. You are each representing a broad group of stakeholders in Montana. You're here for a reason, and we need to hear from you. I want to start by framing our purpose. We're set forth here under the governor's executive order that this task force exists for a clear, practical reason: to make sure that Montana's professional and occupational licensing system is doing what it's supposed to protect the public while avoiding those unnecessary barriers that the governor mentioned that could keep qualified people from working and keep Montanans from getting the care and the services that they need. Over the next coming months, our charge is to take a really hard look together at licensing and across different sectors in Montana to ask some really basic but important questions. Where in Montana is licensure essential to public health and safety? Where have requirements grown over time beyond what is truly needed? Where are we unintentionally limiting access to care or services or skilled trades, especially in our rural or frontier communities? And where can we update our processes so that we are processing licenses and complaints faster, clearer, and more predictably for licensees and their employers across Montana? You heard the governor. We have until September to do this work together and to make recommendations to him, including any potential legislation for the 2027 session. We are joined by a number of skilled and capable legislators here today who have often carried much of this reform work in previous sessions, and we're so grateful for all of your help. This means that our work has to be ambitious, but it has to be concrete. We need to come to solutions and recommendations unilaterally as a group by September. Those things that are agreed on by the task force will make the final report to the governor, and those that don't will not make the report at this time.
I want to make really clear that licensing reform is not about lowering standards for licensure in Montana. We often hear that when we say the word licensing reform, and that is not the point of this task force. Too often we say lowering standards is reform. But if you look only at counts of rules or pages of statute in Montana, it's easier to think that fewer rules must equal weaker protections. That's not the case. We're able to write more direct statute, more specific rules for our boards and licensees without reducing the protections that protect the public health and safety in each of these regulated industries. That's the wrong way to measure what we're doing here is by lowering of standards, and that's not our intent. Our work also sits within a broader statewide strategy. Last August, through the governor's executive order, he created the 406 Jobs Framework, unifying Montana's workforce strategy as an initiative across all state agencies and state entities working on workforce development together. It's focused on 4 pathways to work, 0 barriers to entry for those that are facing barriers preventing them from working and supporting their families, and a laser focus on 6 high-demand industries in Montana where we face critical chronic workforce shortages to move our economy forward. Licensing is a key piece of that 0 barriers initiative, and I know that you are the right people to help us tackle this conversation moving forward. We know that Montana is rich in talent. We have strong training programs, committed employers, and people who want to build their lives and careers here. But in key sectors, we are not where we need to be, and we have critical labor force shortages plaguing communities around the state. We struggle to grow enough licensees in areas like construction, healthcare, and behavioral health. Sometimes it's lack of access to training or credentialing programs. Sometimes it's lack of access to expanded registered apprenticeship, and we need your help to determine the best way forward so we can get the workers we need, skilled, qualified, and trained to safely practice their professions in Montana. That's not a long-term strategy we can accept, just looking at the vacancies and saying, we should do something about that. That's what we're here for today, is to try to start that process of doing something. Your work on this council is going to help us unleash Montanans and the talent they have by removing those unnecessary hurdles, improving retention for making our processes fair, transparent, and efficient instead of frustrating or opaque. And we're going to discuss how we tackle out-of-state licensure in Montana. Should that or could that be further streamlined to allow professionals licensed in other states to safely and responsibly practice across Montana when they join us here? If we get this right, we're not just cleaning up paperwork. I hope that we are expanding access to competent, skilled, affordable services in every part of our state. Nearly 200,000 Montanans are required right now to have a license from the Department of Labor before they can go to work every day. By comparison, we set a record last year of the total number of full-time employees actively working in August of 2025. That was 560,000 Montanans going to work each day. That's nearly 34 or 35% of Montanans that must hold one of these licenses before they can go to work. And we owe it to them to make sure we're getting that process right so that they can work and the public is protected, but we can process licenses quickly and we can process complaints quickly when the public thinks that their health or safety is at risk from a provider. This is even more critical in our small towns, our frontier communities, and our tribal nations. I want to take a pause and introduce you to some of the Department of Labor staffers that you're going to get to know very well over our next 7 months together, who are going to lead us through this work. To my left is Erin Sullivan. Erin is a policy analyst with the legal team at the Department of Labor. For those of you that worked with us on any occupational reform legislation last session, you probably got to know Erin. I would argue that her drafting skills are probably some of the best in town. We are so thrilled to have brought her onto our team after a long career with the Montana legislature, and she will be the core staffer for this task force. So in subcommittee works, as you have questions, data and research requests that you'd like to know moving forward, Erin will be your key point of contact. Also with us, we have 2 of our attorneys, Quinlan O'Connor and Jennifer Stallkamp. Quinlan is Chief Legal Counsel for the Department of Labor, and Jennifer Stallkamp is Deputy Chief Legal Counsel. They spend a lot of times advising the occupational licensing boards administratively attached to the Department of Labor and Industry now. There are 2 of them in the room, not because I like filling a room with lawyers, but because on the off chance that your subcommittees overlap and 2 meetings are happening at a time, we want to make sure that you all have access to legal counsel to ask the big, bold questions you might have. So Quinlan and Jennifer will help us through that. Also with us is Kevin Bragg. Those of you that do work in the occupational licensing sphere have probably engaged with Kevin. He's the bureau chief of Montana's Professional Occupational Licensing Bureau and oversees all of our staff that both regulates and performs the functions of licensing at the department. And last but not least is Lisa Patzer in the corner. Lisa's going to be our technical expert, helping all of you that are attending on Zoom, coordinating our virtual subcommittee meetings, and is your point of access to the department if you have any technical or logistical questions as we're moving forward. We're in really good hands with all four of them. Briefly, we don't have a lot of time. We have 8 months to deliver to the governor a report on our recommendations. In order to do that, I think this task force is best suited by meeting virtually as often as possible, so we can include the broad stakeholder input of licensees and citizens around the state as early and as often as possible. So to that end, we are envisioning 4 in-person meetings, the first of which is taking place right now. The second of which will take place on Monday, April 13th, back here in Helena. And then we know we need to have an in-person meeting in both June and again in August to formalize the task force recommendations to the governor to give us a brief amount of time at the department to do graphic design and put the publication together. We haven't chosen a date or a location for those meetings for August because we want your input over the coming weeks. I suspect we should probably move our work around the state of Montana so that citizens can engage with us without having to drive all the way to Helena. And I suspect that you all have very busy calendars that we need to coordinate with. Erin will be doing quite a bit of polling with you to identify the dates and times and locations for those meetings. And we hope you'll give us your input as to where your constituency or your licensees are best served with us attending. In between those 4 in-person meetings, we envision quite a few subcommittee conversations to take place. In going through the governor's executive order, we believe that this work is best broken down into 4 subcommittees. I'll make that recommendation to you now, and then I'm open to your feedback as task force members as we conclude today of if you think that's enough, if you feel strongly about adding additional subcommittees, or if you have input onto what those are proposed to be. First and foremost, we're envisioning a healthcare licensing subcommittee to focus on healthcare and behavioral health licenses across Montana, to address workforce shortages, scopes of practice, telehealth considerations, and our alignment with the Rural Health Transformation Act opportunity that is a tremendous opportunity for Montana with direct federal investment into modernizing our workforce and environmental space for healthcare across Montana. The second subcommittee we believe we need to convene is a construction subcommittee to focus on licensing in the trades and related professions for how requirements affect project timelines, cost, safety first and foremost, workforce availability, without diluting the standards that are critical to protecting both the licensees and the public in the construction space. We believe we need a subcommittee to broadly discuss barriers to licensure in Montana, to look across all sectors at obstacles that keep qualified people out of licensed professions, whether that's criminal history rules. That's why my colleague, Director Strauss from the Department of Corrections is here. Maybe it's duplicative training or fees or inconsistent standards or administrative delays, perhaps even at the Department of Labor, that are creating barriers to licensure in Montana. And last but not least, a committee to discuss sunsets of licensing and licensing rules in Montana. The legislature in Montana has a very specific and constitutional authority and right to continue to review the laws and statutes that they've passed. And that is much of the work that we will examine in the Sunset Committee is what is the role of the legislature and on what frequency to occasionally look back at the licensing rules that they've passed and to review whether they as legislators would like to update, modernize, or change through a sunsetting process through licensure in Montana. All of these subcommittees will be the backbone of our final recommendations to the governor. At that April meeting, we expect to hear initial committee recommendations of key topic areas you want to work on in each of those subcommittees. I expect that those subcommittees will each meet at least twice between now and April to give you plenty of time to work together and to work on behalf of the stakeholders you represent to bring forward your ideas between now and April 13th so we can frame out the rest of the work of this task force over the remaining months. I want to pause here and invite Director Strauss to share some insights onto barriers from his perspective at the Department of Corrections. One of the most challenging and important parts of our charge is confronting the barriers that we may have created in our own systems. Barriers can look like a confusing form or a delay in processing an application at the department. They can also look like a statute or a rule that permanently excludes people even when their current qualifications and conduct show that they're ready to contribute. Many of the people affected most by those barriers are individuals that have been or were previously involved with our correction system in Montana, or people that are working to rebuild their lives. If we want safer communities and a stronger workplace, we need pathways back to work that are real and not theoretical, that still protect public health and safety first and foremost. With that in mind, I'd like to invite Director Strauss to share his perspective and the work that they're doing at Montana's Department of Corrections to support this task force.
Thank you, Commissioner Swanson, and thank you all for participating here, and happy to share some thoughts from my perspective. My lens in relation to this conversation is fairly narrow when talking about, the workforce that we're contributing from the correctional perspective. But I think the barriers and things that we are challenged with are probably indicative of things that people experience across the board. So speaking from the Department of Corrections, we spend a lot of time talking about rehabilitation and reentry for the populations that we supervise. And we know certain things for sure. There are three primary things that contribute to someone being successful when they leave supervision from us. One is, strong family support. A second is stable housing. And the last is a good, solid career, a job. And we're tasked with preparing people for the opportunity to have a career once they're released from our facilities and then ultimately reintegrated. Licensed occupations are fertile grounds for providing that opportunity for people. So we want to make sure that every opportunity that's afforded to any Montanan is also provided to these individuals that made a mistake at some point in their life, but now are looking for an opportunity to recommit to their communities and contribute in a very positive way. Just to speak briefly about a couple things that we see from our perspective. One is about just opportunity in general. We leverage apprenticeships a lot within the correctional facilities that we use, largely in the kind of the pre-apprenticeship realm, where we get people along that pathway, started towards that. So when they do get released, they can embed themselves in a full-time apprenticeship program. So we're looking for opportunities or other occupations or industries where apprenticeshable work can be done, so that there are more opportunities for those people to something like that. So when there is clear line of sight, when they leave our facilities, they see the path towards a career and towards a good paying job. And we think there are more licensed occupations that should be considered. I know we've done a lot of work in recent time to broaden that across the board, but I think even more work can be done there. And I think apprenticeships also are really important from our rehabilitative perspective for a variety of reasons. One, there's tactical, tangible training that happens inside of our facilities. People are busy and they're working towards something productive, but then also there's a lot of peer support around that. So individuals that have gone through that process can help provide guidance and support for those individuals. Another piece that we've been talking a lot about is collateral consequences. So when someone is convicted of a crime and they go back into their communities, like what stigma and what consequences they experience because of that conviction. There are a lot of cases now where expungement happens. A person is their crime has been expunged, but still, if you look at any licensing application, it asks if you have ever been convicted of a crime. And in order for those people to answer truthfully, they have to say yes. But even though that case has been expunged. So do we want to talk about those types of barriers that are contributing to someone from being unsuccessful when they seek a licensed career pathway? And the last one is about stigma. And this doesn't necessarily have to do with licensing, but I think since licensing is so directly tied to so many of the professional associations that work in and around licensure is, are there employers or careers that aren't suitable for people with a criminal past just because of that stigma? So can we work together to kind of elevate the importance of the career pathway for those individuals and reduce some of that stigma so that they're more likely to be successful when they enter the workforce? So those are things for sure that I want to address through a barrier lens. And then another piece, just broadly speaking, is I think one of the things that people experience through licensing is some uncertainty, especially people with a criminal past. I've talked to people directly that have had a criminal conviction, have gone through schooling, are now getting ready. In this particular case, it was a cosmetologist. And since they clicked yes on the box in the application and went through the non-routine pathway for consideration for licensure, everything worked out great for that individual. But in the meantime, it was very stressful, very anxiety inducing for that individual, not knowing necessarily what the outcome of that process would be for them. And she talked very kind of profoundly about thinking about regressing in terms of her rehabilitation through that process. So anything I think we can do to help promote transparency and visibility to the process around licensing for those individuals is going to be really, really good for us and for the people that I'm responsible for. So having said that, I'm really looking forward to the conversation and the work that we're going to do, and hopefully that we can come to some really good solutions that'll help in the long term. So thank you, Commissioner.
Thank you, Director. So I want to bring us back together as a task force to really start hearing from all of you. I have 4 broad questions, and I really invite you to lean in and share your thoughts on each of them with us. First, maybe a challenge. I don't want us to think about this task force or our work in the subcommittees as a place for minor adjustments. This is a place for you to really advocate for innovation, opportunity, and bring your expertise to bear. We will dig into this far more deeply in subcommittees, but please feel welcome to share your thoughts with us today. At the end of this process, when we deliver our report together to the governor in September, I really hope we'll be able to answer the question, did we make Montana better? Better for patients and consumers who need a safe, reliable service from their licensees, better for the professionals who depend on these licenses and who are ready to work and need a fair, clean path to get there, and better for communities that are struggling to find the licensed providers to recruit and retain people in their communities that we need to thrive in all corners of Montana. So with that in mind, I've got 4 questions I'd like to open up for discussion with you. And first and foremost, I'd like to invite you to share with us your thoughts on the subcommittees. Those committees are construction licensing, healthcare licensing, barriers, and a sunset conversation with our legislature. And I'd like to know from you, did we capture the right areas of focus from your perspective? Are we missing anything? Are there any critical gaps we should consider? Or are there other issues that you think need to be discussed separately and boldly in a subcommittee environment? This is your task force, so I'd like to open it up to all of you. Please don't speak on top of each other, but I'd love to hear from many of you. What do you think about the subcommittee framework?
Director, I guess as we step through your 4 subcommittees, we get down to the end on the sunset committee. I guess I would kind of like a little clarification, because I know sunsets are generally set on a case basis in the legislature as we're writing legislation. What is the expectation to get from the group on that?
The expectation from me is consensus from all of you of what is the regular routine interval, or is there one, in which our legislature should be actively reviewing chapters of Title 37 and occupational licensing. We've had 3 really full years, or 3 really full legislative sessions talking about licensing in individual pieces. Should or could the legislature have a more routine analysis of Title 37? And that's the purpose of the discussion. I know there's lots of stakeholder opinions about that topic, not the least of which from many of our legislators themselves. And so that's why we think that topic needs its own subcommittee to thoroughly talk about what is the frequency, if any, that the legislature should be routinely looking at the statutes, the rules, and the regulations that they've authorized for each of the license traits.
Well, Director, I can say I was extremely happy to see a recommendation of a subcommittee being in healthcare, especially when we look at our rural frontier communities in Montana. There is a dire need for healthcare workers. It's a long process. We have to figure out ways to get people educated, to recruit them, then to retain them in those rural areas. I think with the Rural Health Transformation Program, and especially through Initiative 1, we have tremendous opportunity to look at the system, how we educate, how we bring these people into the communities, how we can use stackable credentials, apprenticeships. I think that's going to be a challenge for the Department of Labor, is if we move from one license into an advanced or a more advanced license, and we're doing that while on the job, that sort of changes the model. I think we'll be dealing with accreditation issues. These things we have to figure out. So I think it's an incredible opportunity for us to really address that. So thank you for making that one of the recommendations. I think that's going to be a major focus moving forward.
Thank you. Yes, Mayor.
When we look at barriers and healthcare, and the 100,000 workers that are not looking for work, and acknowledging what Mr. Strauss said about the reentry. I think there's I don't know, a large group of these individuals are that cross section. I don't know if they fall under healthcare, where you're looking to get people in, or mental health care, where they're not capable or struggling really with the demands of usual work because of mental health issues, and that kind of cliff happens between healthcare that happens within the Department of Corrections and getting into the services. So I don't know. I do think that's something that needs to be tackled, looked at, and I don't know if that should better follow under barriers or healthcare, or would be its own subcommittee.
Thank you, Ms. McCulley. You've jumped us to question number 3. So I'm going to throw that out and just kind of frame that for all of you. My big question is, are there cross-cutting topics that bounce across the 4 subcommittees, much like Ms. McCulley has described? Are there data needs that we have to investigate those issues that can impact, for example, both healthcare and barriers? Is there reciprocity or portability conversations that can impact multiple subcommittees? Or are there administrative process improvements at the department or other departments in state government that can impact multiple of these subcommittees? Should we be intentionally coordinating across all 4 subcommittees? My attempt to intentionally coordinate was to invite my colleagues, Director Brereton and Strauss, here, because I think we're all going to have to put our heads together throughout the next 8 months. But are there other cross-cutting topics, just like Ms. McCulley has identified, that are going to cross us across healthcare, construction, barriers, and sunsets? And how do you want to handle that as a task force? Do you want each subcommittee individually having their conversations and then bringing early identified issues and recommendations back to our 4 task force meetings? Or do you want our staff individually updating each task force what the other task forces are working on? Yes, ma'am.
So my initial thought about the subcommittees is much in line with what you just described. And in my brain, at least the way it works, I see healthcare, construction as one column of subcommittees, and then barriers and sunset as a different column. Barriers and sunset being more global, right? Healthcare and construction being more profession specific. Another profession specific, or I'm sorry, another global skilled versus non-skilled. And I hate those phrases, but if you want to put like degree requirements or educational requirements, regardless of apprenticeship access, that could be another global. Healthcare subcommittee is going to come out with their own set of barriers. Construction is going to come up with their own set of barriers. I'm assuming more in education or more in corrections or reciprocity. And I do think that more emphasis, I don't know if should is the right word, but I hope much emphasis is placed on the conversation around reciprocity, compact creation and maintenance, et cetera. I know that that is a big concern for many of my clients, that when we give a global reciprocity, for example, it puts Montana citizens at risk of a different lower standard. And I want to make sure that that's examined thoroughly here.
Thank you. Senator Noland is with us online and has his hand raised. Do you have thoughts, Senator?
Yes, thank you, Commissioner. Kind of goes back to the previous question that you had, but it'll also tie into this. So, we've been given a charge and an opportunity to think outside the box. I've been in the legislation for many years, not quite as many as my good co-counterpart in the House, Representative Buttry, but we've always thought of things in a certain way. He's an outside of the box thinking kind of guy. I really appreciate him. And we have that now. We want to get together, resolve these issues. One of the things that I appreciate, Commissioner, that the governor's asked, because I get in committee and then people bring to us, fix this. So here you go. There's something out there and we don't know what to do. So we're bringing it to you as legislators. So this task force has a great ability to think outside the box and resolve many concerns and issues. One of the things I would want to just address briefly is on corrections. There is a stigma I get people come to my employment, and I have hired many of these wonderful folks that are trying. And then some of my business people find out that I've hired them and they don't want them in their buildings. So we're helping the society realize people have made mistakes. Think back, hey, maybe one of your kids or your parents, we've got to help them realize this is an avenue. This is an ability. We believe in repentance. We believe in forgiveness. Let's help those people. So I'm hoping this task force can bring to light, hey, this is a way. I don't know. I don't think we can minimize any correction issues. But I hope we can reach out and say there is something that can and needs to be done in that venue, because there are a lot of folks that could really use our assistance. Thank you.
Thank you, Senator. How about anybody else? How did we do on the 4 subcommittees? Are there any critical or cross-cutting strategies across this? Sorry, Amy, go right ahead.
Quick question. Will we be able to at least listen in to subcommittees that we are not assigned to?
That's a great question. The short answer is yes. So all of the subcommittees will be public and on Zoom, just like today. They'll all be published on the new website that we have stood up for this task force, so you and any members of the public can participate. There is no restriction for you on only serving on one subcommittee. If you as task force members care about all 4, I would love to take up that much of your time in the next 8 months to be a voice for your constituency. When we're done with today, Erin is going to communicate with all of you task force members by email to confirm your membership on which subcommittees you want to be a part of, 1 or more, and then we'll start working on polling to schedule when to hold those subcommittees. But there is no restriction on whether you simply attend to observe and listen or provide public comment, or whether you serve on 1 or more of them. The ask for all of you is that you do all serve on at least 1 to help us through this process.
Then to follow up on your initial question, and I'm not volunteering to be on all 4, but I think there will be overlap with some of the subcommittees. I personally think that as a group, then at those larger meetings, together, talk about the ideas and identify where there's overlap, and then go in our subcommittees and work from there.
Great, thank you. Yes, ma'am.
Hi, I'm Allison with Montana Legal Service. I have a quick question. You mentioned data needs and things that were cross-cut. Are we going to have access to data about effects of licensing on the, like, so we can hear from people that are being affected by this situation?
That is a wonderful question, Allison. The short answer is yes. As we begin to dial in on what are those questions, what are the data points that we need, Erin Sullivan is your point of contact to start identifying that, and she'll help us find data sources. The governor also has an item in his executive order. I'm going to go from memory here because it's not right in front of me, that essentially asks, what is the public's perception on occupational licensing in Montana? We are keenly interested in figuring out how to solve that. How do we invite the general public to weigh in on the role and value of licensing? Whether that's through polling or surveying or another mechanism to ask citizens what they think, yet to be determined. We want your input as we move into those subcommittees on what that could look like. But yes, if you've identified specific data points that you think would be helpful to bring the public perspective into the room, please communicate those with Erin. She's going to start working with all of our agencies and national partners on pulling those data points together for us. Senator Harvey.
Yeah, thank you, Director. You know, one thing when I was looking over the subcommittees and the more I pondered it, the more I kind of came to the idea of not adding a new subcommittee, but I wanted to raise for all of the subcommittees the enforcement piece of licensure. You know, as we remove barriers to get into the licensure, I think on the adverse, we owe it to the licensees to have a clear, approachable process for enforcement. You know, whether that's bad actors in construction trades or whether that's licensees in the medical field that stumble, we owe a clear process on how enforcement is reached, how we can get those workers back if they stumble, or if it's just an outright bad actor. How we show our other licensees that, you know, that type of activity won't be tolerated. So I think that's something that we should all be considering as we go through this process.
That's a really great point, Senator. I know many of you in this room have differing levels of experience with our professional occupational licensing boards and programs and how complaints and investigations and screening panels and discipline occurs, but not all of you might. Would it be helpful for the department to schedule like an Enforcement 101 webinar to start with what is current state for those that would like to attend to get up to speed? I know we've got a few board chairs and others that are regular attendees on our screening panels, but we could certainly do a webinar styled public Enforcement 101 session if that would be helpful.
Yes, thank you.
Okay. I think I saw a hand over here.
I had a question about occupations that don't neatly fit into healthcare work instruction. And I don't have the full list of your licensees in front of me, but two that are immediately popping in. Apologists and guides and outfitters, two fairly significant and vocal members of the public. And so I'm wondering where you anticipate conversations around those occupations.
Yeah, that's a great question. And one I was hoping someone would raise. To the point of outfitters and guides, that is in part why we've invited Mr. Seckinger as both a legislator and a licensed guide in Montana to help us narrow in on who are those stakeholders to invite. But I'm certainly open to a subcommittee of other. It's not on the list because simply I couldn't figure out with staff what to call it. But there are many other licensed trades, whether it's real property management, realtors, others. The point is not to exclude those occupations from this discussion. In part, that's why Mr. Lloyd is here representing the licensed CPAs in Montana to bring that voice into the room. We are certainly open to another subcommittee of the other licensees and open to your suggestions on what to call it and how to engage those folks.
So Commissioner, I think when you're talking about crossover, one of the things that we're going to have to consider is speed to licensure. We have some licensure that's done through a board process, other that's done through a program process. I've always looked at the board process as necessary, and I think we have to have that. But the boards only meet periodically, whereas where we have programs, we're using professional staff within the Department of Labor who are always there. That's their job. So what is it that should be board driven? What should be program driven? As we deal with issues, screening panels and such, how do we handle that in such a way that we don't have people waiting for a meeting to be scheduled for their issue or their licensure to be addressed? We need to find a way to get that throughput up as soon as possible. And that would cross over all industry.
Thank you. Absolutely. Ms. Lynch.
So we're going to play off that and also what I heard before. I'm interested in whether or not there has been a list of issues. Is there like an open survey of like kind of what are the issues that people have raised? Obviously, construction and healthcare seems to be one, but as Jennifer said, are there other places where people are really upset and don't like the process? And that's
we're hoping. Yeah, that's a really great question. We're hoping to gather some of that input through public comment here today. We will be putting a communication together from the department out to all of those folks in Montana that hold an occupational license to point them to the website for this task force and to invite their input in a structured public comment format, but certainly open to more ideas of how the public or licensees with issues can raise them before this task force before we begin scoping our work.
And that on what Representative Buttrey just said, I like the Enforcement 101. I think that would be very helpful for me, but I also think like a getting licensed 101 would be helpful for me too. Like, I don't know if that's to go through the board process and that's to go through.
Yes.
Absolutely.
This is Senator Noland again.
Hi, Senator.
Following up on the good Representative Buttrey's comment of when we're reforming things, to letting the licensures know, but given a time frame. So we got to figure out when someone calls and says, is this going to take 2 months? Is this going to take 2 weeks? Is this going to take so long? If we can come up with something that says estimated, and I know the department, when I'm waiting on hold, your time will be 3 minutes. So I know I have 3 minutes. I think the folks, when they are reaching out, say, well, how long is this going to take? And if there's I don't know that we can, and we probably don't dare say it will be 1 week, but if we say it's approximate, but because I have people say, how long is this going to take? So if we can reach out and figure out in these discussions, anywhere from, instead of being 2 months or even 2 weeks, we've come up with a solution of this might take up to, 40 to 8 hours.
Yeah.
Or something. Thank you.
Thank you, Senator. That is important. I appreciate that. Yes, Mr. Lloyd.
I got to double tap on two things I heard. I think first is whenever we're doing something in Montana, we have to be aware of the rural urban divide, and solutions that work one place don't often translate to the other. I know that that's been an issue with many things that get brought forward, work one place but not the other. And so just across all the committees, I think we need to keep that in mind. As we talk about complaints, I think if you look at the report that the department gets to the governor each year, the majority of complaints are dismissed. So I think some level of education of the public as it relates to what are legitimate complaints and what aren't could reduce that volume and give all of us more of our time back. And then the only original thought I had was, as we're reaching out to folks to hear about licensure, I think a group that would be valuable to reach out to are those that applied but were not licensed. And so those folks that ran into a hiccup along the line, or there was some requirement they didn't meet, hearing from those folks would be incredibly valuable.
That's a wonderful perspective. Thank you. So I want to throw out one more question. Oh, go ahead, Director.
Thank you, Commissioner. Logistics wise for the subcommittees, is there a common framework or a standardized framework within which you want the subcommittees to operate and work so that, right, we're checking the right boxes, we're looking at similar issues, et cetera?
Yeah, that's a great question. We do want to give each subcommittee the freedom to identify the core issues that they want to work on, which brings me right to the next question I was going to throw out. So I'll throw that out in response to yours. My question for each of you is, for each of the subcommittees we've identified, that I think we're up to 5 now, healthcare, construction, barriers, sunsets, and other yet to be named. For each of those, what are the 1 or 2 most important things that we need to answer in the first round of subcommittee meetings? I imagine structure, the frequency with which we meet, how they're done is one of those. But I want to give you the ability. This is your task force. These are your subcommittees. What are the 1 or 2 things in each of these buckets that we must get right in this first interim between now and April if we're going to set this work off on a good course? Do you have any suggestions, Director?
I'm thinking.
Yes.
So you have structure, frequency, and I would suggest some type of small scale work scope so it can be elaborated on as we move forward.
It's a great suggestion. Thank you.
Commissioner, I'm going back to a comment came from this corner of the room earlier, but gaining a better understanding of the common complaints or issues for these priority professions as a starting point. So for absolutely healthcare, and then also construction and that other category. But I think your team would know probably how to best compile that feedback based on the work you do every day.
Absolutely. We can pull that together very quickly. Would you like to see that kind of shared broadly in the Enforcement 101 kind of webinar? Would you like to see that sent directly to all of you as task force members to review at your leisure? Both? Is it a separate conversation?
I'd suggest both.
Okay.
Yep.
Thank you. Ms. Lynch.
There might be 2 different kinds of complaints and issues. One are complaints and issues from people who are trying to get licensed or didn't get licensed or operated as a bad actor. And then the other complaint I'm speaking about are people who just have an issue with the process, or does that make sense? Like the licensing.
Yep.
I think you're on the right track. A large number of the complaints we do receive at the department now are from the public against a license holder in Montana, and they feel like there's been some violation that puts public health or safety at risk. And we are duty bound to investigate and take that forward to either a screening panel of the board that oversees that license type or to our program staff. But I'm very mindful of Mr. Lloyd's suggestion that complaints broadly, whether delivered or yet undelivered to the department by current licensees about the process or by those who pursued licenses and didn't get them, is a really important perspective we need to find a way to bring in.
Commissioner, I would see something for the next meeting, what I'll be doing. And I think in healthcare, all those of us involved in healthcare here and other industries is between now and April to go out to those people that are actually practicing and licensed and find out from them through a survey or whatever, what their largest issues are or their most important point that they think needs to be answered, then to quantify that and bring that back to the subcommittee and say, this is what I'm hearing from my people are the issues that they want us to resolve. So, I mean, I think that's my role here is to get that input before the next meeting.
Thank you. I appreciate that.
Another question about the rules. I like the rules. I anticipate we're going to get a lot of great suggestions and ideas that pop out in these subcommittees or in between that should happen and will decrease barriers and increase portability, et cetera, but that don't fall into the purview of this task force, right? Top of my head, I'm thinking funding, right? So where, and I guess this is my formal request, that we have a dedicated parking lot or other items for either members of the public or other legislative members or these legislators to choose from for potential legislation, because I think that we're going to get some gold ideas, but I also don't think that they'll make it into the report.
That's a great distinction, and I'm glad you brought it up. A parking lot of some sort is a great idea. What I'll share broadly with all of you is that we really aim to keep the work of this task force within the statutory authority of Title 37. I know, for example, in the healthcare crossover, lots of licensed professions governed under Title 37 care deeply about, for example, Medicaid reimbursements from Director Brereton. I think those are great parking lot issues. We probably won't dive into them in this task force because we have no authority in Title 37 to influence Medicare payments and billing in Montana. But they're important to the licensees that practice in those areas. So I think a parking lot's a great way to address that, or things that would fall in the purview of other agencies. We do need to keep our work because we only have 8 months specific to the regulatory framework of Title 37. Yes, ma'am.
Commissioner, hi. With respect to the executive order and the funds for this delivery system, it talks about modernization of the healthcare delivery, strengthening the rural workforce. Is the modernizing of the rural healthcare delivery fall under Title 37? I think that when we look at healthcare as one of the subcommittees, we got a licensing thing that demands focus and attention, and then this other mention in the executive order about modernizing healthcare, which I think make our workforce more capable and better workers.
Yeah, that's a great distinction. I think it's really it's both. We need to keep the work of this task force within the regulatory framework of Title 37, but we need to bring forward to this task force workforce gaps or barriers or things that, whether it's a rural or remote community or lack of access to training or apprenticeship or qualified graduate medical education programs, what are the things leading to workforce gaps in those professions that limit our ability to recruit, retain, and have those licensed professionals? While we can't influence the facilities themselves or the employers, we can influence broadly the framework of training, application, and licensing those professionals. And I think that fits here. And we're going to have to be flexible in navigating that together over the next 8 months.
So follow up on that. So kind of, it might make more sense for the consideration of the workforce of the construction industry, because that's largely where the criminal recidivized workers come from.
So absolutely. I think that's a really good identified cross-cutting topic where barriers is going to find its way into both healthcare and construction subcommittees too. Ms. Lynch.
On those same lines, there's been a lot of work we've been looking at least in building codes related to zoning reforms that is within Title 37, but not necessarily licensing. Is that something that we should be looking at?
I think it's a great opportunity to have the conversation. If we can find a thread back to the licensing of those traits, absolutely. But quite simply, if we find a pathway to work on the regulatory delivery of the Department of Labor, I'm happy to hear about it. And then we will redirect into the actual pathways to licensure and regulation for the recommendations of this task force. For example, I can't imagine that our September report to the governor will include recommendations specifically about whether it's Medicaid building or billing or building codes, but where they pertain to the licensed tradesmen and professionals themselves, I think it's worth discussing in the subcommittees. Yes, ma'am.
For that first subcommittee meeting, would it make most sense for all of us to come and identify what our problems are before we start talking about our solutions?
Wonderful question. We're on to final question number 4.
Oh,
thank you.
sorry.
Yes.
Good transitions.
Yeah.
So my final question to open up to all of you is, are you, the licensees you represent, the constituency you represent, are you coming to the table today with recommended reforms that you'd like to posit to the group? This is not your only opportunity to have that conversation, but many of you have these conversations day in and day out with the stakeholders you represent. If you're coming with specific recommendations today, we'd love to capture them so we can start thinking about who are the right guests and experts and professionals to invite as presenters and experts to our first round of subcommittees. If you'd rather keep that close or go back and meet directly with your stakeholders to gather that list, that's fine too. But my biggest question for you now is, are any of you coming to the table today with reforms that you believe deeply we need to be considering? We'd love to capture that so we can start pulling in the right stakeholders over the next weeks. Yes.
Yes, Director. I'll be, of course, with AFL-CIO, we have a lot of people on board. So the plumbers would like to present some reform, some form of reform coming up. They have several things they would like to try to fix or alter to make the board smooth out a little bit, and we will be coming in the future with some of those recommendations.
Thank you. Representative Etchart.
Thank you, Commissioner Swanson. One of the things I'd really like to see us be able to look at in the healthcare subcommittee is making sure that for license portability across states, that we look at all the different compacts that we have not included. I think one of the ones is social work, emergency medical services, and that Senator Harvey could also help with in that, and some ideas there, possibly dentistry. And so I think that those are some good things. And also I'd like to have the subcommittee on healthcare really look at making sure that each and every profession, healthcare profession, practices to the extent of their education and training to increase healthcare access in the state of Montana.
Thank you. And for those of you that don't swim in multi-state compacts quite like we do at the Department of Labor, there's a couple more that if we are going to consider compacts, I'd like to throw out just for you to be thinking about. There is also a National Barber and Cosmetology Compact that Montana is currently not a member of. That could go very well in our other box that we're happy to talk about. Mm-hmm. There's also the Advanced Practice Registered Nurse multi-state compact that we're not currently a part of. But beyond that, with everything that Representative Etchart listed, the Social Work Compact, the Dentistry and Hygienist Compact, and the EMS Compact, I believe that's a full listing of those compacts that are available that we're not currently participating in for Montana. Mr. King.
Thank you, Commissioner. I appreciate the comments by Representative Buttrey. From a pharmacist standpoint, it seems like we're not there yet, but with the rural healthcare transformation funding, as well as some of the legislation that's passed, having pharmacists be as approachable as they are, especially in a lot of the rural communities in Montana, we'd like to see those can maximize the pharmacist's ability to help serve our Montanans.
Thank you. So I'd like to restate that final question just to give you an opportunity to weigh in. Are there any specific items under the 2 or the 5 subcommittees we've identified that you think the first gathering of these 5 subcommittees should speak to? Do we have somebody online?
Teal.
Okay, Representative Teal, would you like to go next?
Sure, thank you. And I was excited to see construction listed as one of these subcommittees. Certainly that's a vast industry that could probably use some review. And hopefully this is the appropriate time to mention it, but Obviously, we just passed the contractor licensing change, so perhaps some further conversation about that. I know you guys are working pretty hard at getting that set up and going, but I'm sure there's more discussion to be had. And then also, I think the independent contractor program, this might be a good spot to review that. That program is a great program. It's grown and changed a lot in the last several years. And I think it could really just use another review, maybe from a group like this.
Thank you, Representative Teal. And Senator Noland, did you have another comment?
I do. If you ask me, of course, I'm going to say something. I always have something to say, but following on along the heels of Representative Teal there, I've been asked by lots of different folks, and this is specifically dealing with it's contractors, but it's developers. And when they have consistent fix-ups where a developer, for example, we could use that, they put a road in and then they have to fix it 2 or 3 different times, and the person keeps getting contracts, and it's hurting the industry and it's costing us all more money. The safety aspect, the cities and counties are doing their job by not allowing some of this to happen, but it's still hindering. So some of these folks have asked me to say, okay, what should be done? Can there anything be done? And should we be looking at these guys having a bigger bond, so that if they mess up on a regular basis and they are allowing, because we usually take the lowest bid, how long do we allow that to happen? Anyway, that's just one of my thoughts.
Thank you, sir. And I think we have another question online. Mr. Tanner Avery.
Yeah, I think it's been mentioned already, but I would be remiss to not double down on this point as well. Frontier's worked quite a bit with actually many of you to make sure that license holders can practice the full extent of their training. Some good examples of the past would be physician dispensing and pharmacist prescribing. I think that should be an overlapping theme, making sure that we're having all of these license holders just really practice the full extent of their full training.
Thank you, Mr. Avery. How about anyone else in the room? Are you and the constituents or licensees you represent coming to the table with specific recommendations or reforms that you'd like us to be bringing experts to those first subcommittees to start discussing?
Commissioner, so I did get someone that reached out to me. It's outside of anything we've discussed so far, but it's dealing with real estate broker licensure. They're frustrated that licensure is based on number of transactions and testing. Basically, there are some areas where there just isn't the opportunity in Montana to do a lot of real estate transactions, but folks have the education and experience, and that doesn't seem to count towards that broker licensure. So I told them I would bring that forward if that was of interest to the group. The other question I had is, do we feel like in industry we have an issue with protecting still with our licensing? It's something I've wondered. I don't know. I know it's a hard question maybe for the department to answer, but do we feel like that's an issue because our boards are made up of licensed professionals? It would seem that inherently there's some protectionism. Does that affect industry in Montana? And if it does, what are potential remedies that we could use to get past that? Because if there is protectionism, then that's a barrier to more people getting licensed. And then finally, thank you. Mr. Strauss's comments really interested me in people that have criminal backgrounds to some level and how that's affecting licensure. I guess, is that across all licensure? Are there some that really don't care? Are there others that it's a big deal? Or is that just a process? If you have a felony or some level of criminal background, then you need to report it. Is that across the board?
I think generally speaking, it's not across the board. I think by and large, most occupations that allow for people with criminal backgrounds to be licensed get licensed eventually. I think there are opportunities to streamline the process for those individuals a little bit, and I don't know if there are opportunities to expand the type of occupation or try to take advantage of. That'd be a question I feel. I think just broadly speaking, there is an opportunity to improve access to licensed occupations for formerly convicted people. Thank you.
Mr. Jensen.
So this kind of rolls into our board of professional engineers and professional land surveyors has actually been working on this type of a task on our board specifically. And what we were looking at is the three-legged stool, the education component, the testing component for minimum competency, and then the experience, and how that relates to becoming a licensed surveyor or a licensed engineer. And we were as a board looking at those components that we have and how that potentially creates a barrier, even along the lines of protection of folks. And one of the things that we're identifying on the education side is some of the requirements got very, very detailed about how many classes you have to have of a particular subject. And, you know, okay, do you need 9 credits of AutoCAD to become a licensed surveyor? I don't believe so. You know, so I think somebody wrote that in there to protect some requirements. And so I think that this is stuff that we were doing, and this rolls into this task force. And I think it's a great opportunity now on maybe on as a construction side to
That's why we're here today.
To look at all of the different licenses, the plumbers, the electricians, the landscapers, the architects, the construction contractors, all of that in that group as a more broader, how is the three-legged stool rules set? So I'm looking forward to it, and yes, we're looking at it.
Thank you very much.
I just to play off of that, I think the accountants have a similar issue here. We require a set of specific classes, and we often run into people that, and maybe they got an education in another state, and the other state called something slightly differently, and it becomes an issue. I don't know if we have anybody in the task force representing the higher education to give us that background. So those might be folks to bring in to educate us.
That's a great conversation to have. We're happy to bring in our partners from the higher education system across Montana as either presenters to the subcommittees or experts to have on hand. We'll make that connection this week.
Commissioner, on the looking for specific items to bring to the first subcommittee, in recognition of the barriers and the interest of getting criminals licensed, and my experience and many common knowledge of the high prevalence of mental health in that subset. I would like to ask for expert that could maybe speak to the SDMA waiver and the ways to ensure that newly released population gets covered appropriately for their insurances, so that we can treat their mental health to make them employable. Secondarily, someone who can read the Social Security Act that defines what an inmate of a public institution is, because that is a subset that changes the funding for all across that board.
Yeah, those are great suggestions. I think they'll fit really well in the barriers subcommittee. I'm hoping that both of my colleagues to the right would be happy to contribute to that with their expertise. We'll get the lawyers started on the Social Security Act review and bring that into the barriers subcommittee as well. Great suggestions. Thank you.
I would like to see a conversation around apprenticeship broadly and its relationship to licensure. Like, I know there's been some work done to broaden the types of occupations that can be apprenticed, but is there additional opportunity there to expand it? I'd love to hear a presentation on kind of what that opportunity looks like for all Montanans. And then just separately, I would say, and I'm not going to make eye contact with anyone over there when I say this, I would suspect that the staff at DLI has great insights into barriers or other areas of interest that the subcommittees would be interested in. So if they're willing and able to provide us some direction on where there should be some exploration, I think that would be helpful.
Thank you, Director. We do plan on opening up a public comment portal. In fact, it's open now for members of the public to help us identify those barriers or those gaps. Our staff does have some suggestions too that they're happy to visit with the Barriers Committee about. On apprenticeship, we have done a tremendous amount of work. The registered apprenticeship function for the state of Montana also resides within the Department of Labor and Industry. Last legislative session, we passed a bill that created 32 new pathways specifically to occupational licensure through registered apprenticeship, but it's still really new for many occupations that are licensed and the boards that regulate them. For those that would be interested, we're happy to have kind of a cross-cutting apprenticeship 101 webinar as well. Or if you think it fits more specifically, Director, in one or more of the subcommittees, we can take it there as well. But we can also facilitate Apprenticeship 101 broadly for any task force members that would like to start there.
I think that's a perfect place to start, if that's possible.
Wonderful. How about anyone we haven't heard from yet? Are there any specific issues that you, your constituents, or your licensees would like us to start out with the plan to address? Mr. Harding.
I'm just going to be interested in the will of this group over time. We all know that the ICEC thing with the construction industry comes up legislatively every year with somebody did something wrong somewhere, and there's some sort of idea for sure coming from the general public that additional licensing requirements, testing, ongoing education would fix this problem. It's just going to be interesting seeing going forward if there's any appetite to do that, because that kind of flies in the face what the governor's talking about right now as far as additional licensing requirements. So our industry is mostly not in favor in adding those types of regulations and rules, but there's a few folks that are, and it comes up legislatively every year. And one of these years, we're going to have enough people in the legislature, they're going to add some rules to this. But it'll be interesting to find out if folks really think that that's a fix because you took a class and now you know how to build a house. Or you know how to be a fair person. Honest person.
Thank you.
So
That's great perspective as well. Has everyone in the room been able to offer your thoughts as to where the subcommittee should start working? Mr. Longcake.
The only question I have is, I think many of us are going to have multiple committees that we're going to be on, and I'll pick on construction since it's the first one chronologically scheduled. I'm sure you have a process in mind on how you're going to summarize that to send that almost to the next committee. From the standpoint of if you're looking at barriers, if you're on the second committee, if they've already identified 5 barriers that you have, there's no really reason to dig into that. It's the opportunity to think outside the box. And so my thought was if you were able to find some process to get that by the time you get to the sunsetting and the barriers, you've already kind of put your list together of the most common issues that have been raised. And it would not limit those next committees from having to spend extra time on things that have already been flushed out prior to that meeting being scheduled.
Yeah, that's a great way to handle it. Thank you. So let's talk a little bit about next steps. I think that's a great segue. Over the next coming days, each of you on the task force is going to hear Sullivan. And in that communication, we'll be confirming with you your membership and participation on which subcommittee or committees that you'd like to stay engaged with. And in addition to that, we will ask you, based on the subcommittees you are attending, to also be communicating broadly with the stakeholders, licensees, and constituents in your purview. If you're a legislator, if you're a licensee, if you represent an association or a trade union, we're going to ask you to help us make sure that each of the subcommittees, once the agendas are put together, includes the right members of the public and stakeholders to weigh in and participate with us. In your communications with Ms. Sullivan, we'll start framing out with you the early agendas for each of those subcommittees to take place over the coming weeks, clarifying any expectations, timelines, or deliverables that we need to come to the meeting with. For our first meetings, that's more deliverables of this department for all of you. What data do we need to come with? What experts or discussions do we need to have? Clearly, we've got a little bit of work to do to stand up some 101 sessions on enforcement, license applications, and apprenticeship. But clarifying those expectations and deliverables, you'll hear from Erin over the coming weeks. And then Our intent for the first meeting of each subcommittee is absolutely to ensure that each subcommittee leaves with a clear work plan, including what they will bring back to this full task force at our next in-person meeting on April 13th, and really where they see their work going over time so that we can work backwards within the very limited amount of time we have in the next 8 months to do this work together. Have I missed anything that's important to any of you to be done in the coming days to a week? Ms. Lynch. Oh, that's a great suggestion. Erin can help us pull that together.
Commissioner, thinking about processes that have worked for DPHHS to collect information in a very from the public in a very short period of time, is there any sort of RFI process that or request for information RFI that DLI is issued? Thought I heard you reference a portal or something to that effect.
Yeah, we haven't stood up a formal RFI process yet, although we certainly could if this committee was interested in that. What we have established is an interested parties list at the Department of Labor. All state agencies, if you're not familiar, maintains interested parties lists across key subject areas. We have established one for licensing. Erin will distribute that to all of you in kind of the follow-up email to this meeting. And we're intending to broadly publish that out to active licensees, trade associations, and those that represent these constituencies for folks to stay involved. They'll get an immediate meeting notice when any subcommittees are scheduled. They'll get the agenda. They'll be invited to participate. Right now, that is what we're using, as well as there is a public comment portal open on the department's website. There is a website specifically for this task force that Ms. Sullivan will be sharing with everyone at the conclusion of today's meeting. And there's a public comment portal there. We did already begin receiving some comments from the public in the last 24 to 48 hours. And so we will be compiling those and sharing them on a regular basis with either the subcommittees or the full task force. So you can see the feedback we're getting from the public. If it becomes necessary to open a formal RFI, we're sure willing to do that, but we haven't at this time.
Sounds good. Thank you.
Yes, ma'am.
Logistically, how is the information going to be preserved that happens at the different subcommittees? I'm thinking not so much for myself, but many of the occupations, you know, between bankers' hours, when I assume we're going to be meeting, they're actually at work. So where can they go and listen to these conversations, look for minutes to preserve records? Is AMPAN going to be at all the subcommittee meetings? Are they all going to be open to the public? Those are the sorts of questions I'm getting.
I'm trying to find for you the actual website. I will have it for you before we're done here today. I have a hyperlink on this form that I can't read to you, we'll read it into the record here in just a moment. But the short answer to your question is that all materials of the subcommittees and the task force and any research that we compile will be published on the task force website that we've established. All of our subcommittee meetings will be held virtually and will be recorded. And any meeting notes of those that Erin compiles as far as next steps or actions, both the video and those notes will be posted on the website. And over time, as we bring the public comment to all of you, that will also be posted on the website after the task force has had a chance to review it.
It's okay. Can I read the?
Yes, and Erin will tell you where to find the website. Thanks.
Okay, so the web address is esd.dli.mt.gov/licensing-task-force. And yeah, it's a mouthful.
So, Commissioner, to clarify again, will the information that's being submitted to DLI through that public comment portal in written form be disseminated to the relevant subcommittees and task forces? And if so, who will send that information?
Great question. Yes, all of the public comment we receive will be sent to the subcommittees and to the full task force at each of our 4 meetings. That will be sent to you by Ms. Sullivan. I'm hedging a little bit on when it might be available to the public, because my intention is for the task force members to see it first, to kind of plan what the added presentation or exploration of that is. And then it will be available to the full public also once the task force has directed us how you'd like to explore those sections of comment or further information needed. And you'll get that from Ms. Sullivan.
Another logistics question.
Yes, ma'am.
Will Ms. Sullivan be sending it email, or are we going to have access to a SharePoint so we can like go there instead of having to search through? How logistically is that going to flow?
We do not have that fleshed out yet, but I would be very interested in how you prefer to receive information. I imagine your inbox looks much like mine. We can email you every day if you'd like, or we can also establish a SharePoint for task force members to access documents.
I vote for SharePoint. SharePoint. Yes.
Expenses. We can establish that fairly soon and get that link out to everyone. So I do see that we have a number of members of the public with us. If there's no more direct input from task force members, is there any online, Lisa?
Yes, it looks like Vicky Bird and Ross maybe.
Okay, those are public comment. We'll hold on for just a minute. So I'd like to move us into the last part of our segment, which is public comment. Many of you that are familiar with the legislative process know that every public hearing is entitled to public comment. Folks can share their perspective about what's been discussed here today or their suggestions for us as stakeholders on how we should proceed. Normally in public comment, we do not respond directly, although those of you that give us information today will very likely be contacted by Ms. Sullivan to figure out ways to address your concern in your subcommittee meeting. We want to make sure we get that interested parties list. So with that, I'd love to move us into public comment. Stakeholders in the room. When you come up, please treat this just like a legislative hearing. Please identify yourself, state and spell your last name, and tell us who you represent. You can't see it behind this pillar right over here. There is a podium for any stakeholders in the room that would like to provide public comment.
Couldn't hear what you were saying. I apologize. You want me to go up there?
Yes, thank you. So everyone can hear you. Thank you.
My name's Matthew English, just like the language, E-N-G-L-I-S-H.
Thank you.
I'm a journeyman electrician, been for 33 years. I don't represent anybody in particular. I have worked all over the western half of the US, from nuclear plants to coal gasification plants to high rises. I've watched the electrical industry change in those years. And the reason I'm here is to share my concern with how I've watched it degrading. The quality of work is not what it used to be. The requirement for that is not what it used to be. So I would ask that as you're finding ways to streamline, because I'm all about streamlining, and I am currently the manager for a electrical company, and getting labor sometimes can be difficult. I mean, I get it, but I don't want to risk quality for quantity. I also sit on an apprenticeship committee, subcommittee. So as I go out in my daily work, I see a lot of unsafe things that are allowed to happen. Whether they're missed from inspectors or not the proper permits being pulled or whatever happens. I encourage you folks as you're doing this stuff, that we don't lose the education that is necessary for some of these trades and the requirements for maintaining them. To speak towards the enforcement, I deal quite often with the local inspectors, and they feel sometimes that their hands are tied because there's not funds for the enforcement to take place, and that's not okay. I mean, they're there to make sure the job's done right, but if you can't pursue enforcement, so yeah, I think that's about all I had.
Thank you, Mr. English. About anyone else with us in the room today? Is there any additional public comment? Okay, let's transition to online. Lisa, do we have public comment online?
Yes, ma'am. Hi, Miss Annie Ross.
Miss
Thank you for the opportunity to speak with you all. My name is Ann Ross, last name R-O-S-S. I live in Billings, Montana. I am part owner of a union electrical contracting business. We work in local 532 and 233 primarily. I have a few things just to mention in regard to these meetings, and I appreciate the electrician who just spoke in his concerns as far as licensure and the quality of work. So one thing I want to mention is that in Greg Gianforte's executive order, he mentioned that the number of licensees has more than doubled in the last decade. And that seems like a pretty good metric to say that things are pretty good as far as that goes. And that's evidence that the barriers to entry are not extensively prohibitive. One thing on the DLI website, Montana DLI, you have a lot of reports on there that speak about the barriers to entry in the workforce and why these people that are working age are not actually working. And of the 10 or 15 main barriers that have been reported, not a single one had anything to do with licensing. The top ones are lack of transportation, criminal justice issues, and the third one is lack of childcare. The Bozeman Daily Chronicle recently reported that around 40% of the people, the 100,000 people that Greg Gianforte is concerned about not working and not seeking work are actually parents. And so the main barrier there is that there is either a lack of access to childcare or it is not affordable in the state. So I know that that's not part of the Title 37 scope that you're looking to work within, but I want to make sure we don't create solutions that are seeking a problem, that we're actually finding reasons that are real. So I appreciate the legislators in the room that said that they will actually survey their constituents. I would highly recommend that you do survey all Montana licensees to seek out what the actual problems or barriers have been for them, rather than speculating and creating new laws that have no substantive evidence behind them. On licensure, I know there could be a possibility that one of the recommendations would be to remove licensure in a given field. And I just want to note, public safety aside, that if we remove licensure for a trade, oftentimes the consequences are that you take one of the so-called good jobs that are higher level pay and you drop it down to an entry-level job. And with that comes the commensurate wages, benefits, and overall perceived value to society. So I think that licensure is an important thing, not only for public safety, but that you also need to consider the people in the trades and whether their overall compensation packages would deteriorate if you delegitimize their claim for licensure. Third, the tradespeople tend to be like, I think, for example, I was a manager in the spa industry when the massage therapists became a licensed occupation, and they were the ones that actually sought that out, the massage therapists themselves, because of bad actors. And that's a way to make sure that we're providing safe care, but it also provided safety for the workers. By bad actors in the massage therapy business, I think we can all kind of speculate it. A lot of it had a sexual tone to it, people propositioning them on the massage table to provide extra services, and that safety actually improved for the workforce when we brought on licensing for massage therapists. So quality, safety, and job security is another one. You know, if you require licensure for a certain scope of work, that does enable workers to have a say in how they negotiate their contracts. And that's a really important thing. If anybody off the street can come and do this licensed work, then it puts more bargaining chips in the bucket of the people that would financially benefit from cutting corners and shirking their duty to public safety. So just a thought in that. And then in regards to these meetings, this is my final thought. I'm sure it took some level of planning and scheduling in order to bring your board members together. And thank you everyone that is here. I appreciate everyone's interest in licensure. But I'm curious why the licensees were only notified about this meeting last night. My husband is the electrician in our contracting business, our master electrician, and the email came through at 6:48 p.m. And today it is a meeting at 11:30 a.m. during working hours. There is no conceivable way that he can attend this meeting. And he is an owner of his own business, and sure, he might be able to clear his schedule, and you might be able to get a few contractors that can clear their schedule. But the actual labor force that are W-2 employees is not going to be having that same opportunity. So it's the same kind of issues that we have with, office hours, is that, I strongly encourage you, first of all, to give more than a few hours notice. That wasn't even 24 hours notice for this meeting, where they are major stakeholders in the consequences of the recommendations that come forth. But that you consider having your future meetings toward the end of the workday or in other ways, like possibly on the weekends, so that more licensees can attend, and making sure that if the licensees cannot attend, that we do have more representatives from, like, the labor unions, for example, a representative from the IBEW who can speak to the scope of work specific to electrical workers and the safety concerns and needs of that group, to have a pipe fitters leader that is actually somebody that was elected by the workers as a representative, over solely having contractors organizations. And I know we do have one AFL-CIO member, but I'm not sure how deep into the scope of work of each individual labor force he would be able to be, and if he is able to be a higher level representative as far as like being a committee co-chair or something like that in the future meetings. So thank you so much for the opportunity to speak.
Thank you, Ms. Ross.
Stephanie Lear.
Ms. Lear?
Thank you. My name is Stephanie Lear. That is L-E-R. I am a registered sanitarian. I have worked in Sydney for 15 years. I don't necessarily have public comment. I just see that we are not directly represented. We kind of fall in an odd little category that somebody had mentioned earlier. But I was more just making it known that I was following your work on these matters.
Thank you, Ms. Lear.
All right, Vicki Bird.
Ms. Bird.
Thank you. I hope you can hear me okay. Vicki Bird, BYRD. I am a 38-year registered nurse and the CEO of the Montana Nurses Association, and Commissioner Swanson and the Licensing Task Force. I would just like to respectfully request a consideration for an additional appointment to the Licensing Task Force. M&A has since heard from several Montana nurses, as well as from our organizational affiliate, the Montana Association of School Nurses, that we were kind of unaware of this opportunity to apply for this task force. And in several instances, some of the notice went to spam or routed to junk. It just is what it is with all the technology. But given the importance of, having a professional nurse association representation on this task force, M&A believes it's critical for nurses to still have the opportunity to participate. And given M&A's role as the statewide professional nurse association, we believe that having a representation at the table would be meaningful. And we respectfully request that an additional appointment is considered by this task force. And if granted, our M&A Director of Professional Development, her name is Kelly Hunt. She is a master prepared clinical nurse leader, board certified. She's able and willing to serve and has been on this call today up until just a few minutes ago, had to go to another meeting. So she was able to hear all the productive discussions. And so thanks for your time and consideration and commitment to inclusion and informed stakeholder engagement. And we would love to participate. Don't hesitate to reach out and let me know. Thank you.
Thank you, Ms. Bird. Lisa, do we have anyone else online?
Nathan Staley.
Hello, my name is Nathan Staley. I am the Executive Director for the National Association of Social Workers, the Montana chapter. And I'm sorry I can't be in person today. I would have loved to be there. kind of reflecting on Ms. Bird's comments, I would love for the social workers across Montana and our association to be more involved in this process. I wish I was a part of this task force, and if there's any way that I could be a part of it, I would love to be. That being said, social workers, we have across Montana over 2,500 licensed professional social workers, and I speak with them regularly. And there's a lot of opportunity for us to be involved with one or more of the subcommittees, and I'm eager to be a part of those conversations. I love what we're talking about around reciprocity issues. How do we look at compacts? Of course, the social work compact. Chair Swanson, Ms. Eckhart, talking about that. I'm very much interested in those conversations, and we have data, we have information, we have our members across Montana who are social workers who would love to be a part of these conversations. So thank you, and I just appreciate that we're doing this. I'm eager to be involved. Thank you.
Thank you, Mr. Staley. Next.
Rand Dickinson.
Hello. Yes, I'm Rand Dixon. I Dickson, and I'm representing MEMSA, the Montana EMS Association. I'm a parent myself, and I wanted to just voice my support of joining the EMS Compact. That's important for Montana to do, as well as the concept of working at full scope of your training. I would see that happening. And then I would also like to see an EMS apprenticeship program where young people can come and learn EMS, not necessarily a formal class, but by participation in ambulance stations throughout the state. And I'd also love to have further participation in this task force if possible. Thank you.
Thank you.
Edward Timmons.
Hello, can you hear me?
Yes,
Yes, we sure can.
Thank you so much. I appreciate the opportunity to speak. My name is Ed Timmons. I'm the Vice President of Policy at the Archbridge Institute. We're a think tank dedicated to removing barriers to human flourishing. I'm a PhD economist, and I've been studying the effects of occupational licensing for the last 20 years. I'm happy to serve as a resource for this task force. I can speak to what the academic research says about the effects of occupational licensing, talk about alternatives, talk about what other states have been doing with respect to occupational licensing reform. And I just appreciate the efforts of the governor to take a hard look at this institution. It affects a large number of workers. We have a lot of evidence on the costs and the consequences of occupational licensing, and I think it's a very important topic. Thank you very much.
White.
Hello. All right, my name is Dwight Rowland. I run a electrical contracting company here in Bozeman, and I operate under a limited electrical contractor license. The big barrier that I face and a lot of journeyman ran shops is our ability to hire and effectively scale. I'm not able to hire apprentices and have their hours count towards their journeyman license, meaning like I can't sign off on that. That's only doable by a master electrician, which also hamstrings me in a way too. I have to either shut my business down or I have to hire one, and there are not many of them out there. So I just wanted to bring that up because it would be nice to have some kind of remedy to that. Especially for those of us that focus entirely on residential work and don't do commercial. So not sure if I conveyed that properly, but yeah, thank you.
Thank you very much. And I think we have one more.
Elise Bain.
Hi, I am Elise Bain, Baine, and I'm with the Federation of State Massage Therapy Boards. We just also would like to ask you guys to consider making an additional appointment for massage therapy, just due to the intersections with human trafficking. So thank you very much.
Thank you. And I think that's everyone online.
And Emily Coulson.
Oh, one more. Emily?
Hi, my name's Emily Coulson, Colson. I'm a student midwife. I attend Mercy in Action College of Midwifery. I started in 2021. Hopefully I'll be able to graduate this year. But the reason why I was trying to bring up today is for Montana licensing. So with apprenticeship, and I assume that midwifery is not the only one, we have like a North American registering body. So midwifery has North American Registry of Midwives, NARM. We go through them for the most part. And they have all the things that we have to do to become a registered midwife, including like 2 years, continuity of cares. Montana in particular actually goes 3 times above that. So for us to be able to, I'll graduate this year, but I'll probably take another 6 months to a year just to be able to license in Montana. So I do know that that's, and I'm not I've been with students that have had the same issue where they could have graduated, but they just weren't able to because of Montana, and they've had to take that 6 months or more to try to get licensed. And that's just, it's been kind of a blockage. I know that some even student midwives just never finish just because of how hard it is. Because just in midwifery, trying to become a midwife, I personally have to drive an hour and a half to one preceptor and 3 hours to another. It's a gate kept occupation to try to get into. But so even with like the continuity of cares, which are 3 times as many, that means I have to make sure I'm driving these every week. I have to drive around to be able to even just be, so I could get to these appointments. Just not just even with myself as a midwife, as I know it's just a very small thing to look into, but I would recommend just kind of looking at apprenticeships, and if there is like a North American registering body, just make sure that Montana meets those same and doesn't overboard it. And that's pretty much it. I can go into so much more of like how midwives and being able to get more midwives would help rural maternal health care in particular, because we just need more midwives out there. And especially for like prenatal care, in between prenatal care and getting to hospitals. But thank you so much for your time. I appreciate it.
Thank you.
Kylie Earp.
Hi, yes. So my name is Kylie Earp. I'm actually a candidate for my Master's of Social Work licensing. And I just actually wanted to echo what Nathan Stolley was saying about having a social worker be appointed on the board. I think it's really important to have a voice for social workers be present. It's such a wide and varying profession. I mean, I think everybody in the room has at least either worked with or have been in contact with, speak to some form of a licensed social worker, whether it's clinical or in a master's position. So I just wanted to echo his request. I think it would be very important to have somebody there to speak on this profession. I also wanted, in my professional working role, I work as a human trafficking advocate for the state, and for those who are speaking on behalf of the licensing for the massage businesses, as somebody who works in that field working with victims who have been associated with illicit massage businesses, I think it is very important to have those voices present as well that work in that industry. But thank you so much for letting me speak.
Dr. Samantha? Dr. Samantha? All right, we'll go to Marty Wagon.
Hi, my name is Marty Wangan, and I work for the Montana Optometric Association, the Montana Podiatric Medical Association, and the Montana Psychological Association. And I'm hoping that if you're considering other members for the task force, that you will also consider us. Thank you.
Dr. Samantha?
Hi, can you hear me this time?
We can.
Thank you. Hi, this is Dr. Samantha Rafie, R-A-F-I-E. I'm a clinical psychologist in Flathead County. Just a couple of things to consider. I second the consideration for surveying the stakeholders, so licensed individuals in each occupation across Montana. I think some of the barriers will come out through those surveys, but a couple of things to just point out would be cost and administrative burden. So the cost of licensure can be prohibitive to the point where people may choose not to engage in a profession or occupation. I know for psychologists, the fee sometimes is waived to zero, which is great. But when it's not waived, was $450 for 1 year, which is significant. So I would really like to see that be addressed, considering that is double what it would be in California. So why is it so expensive? The other point is to do with the administrative burden. The requirements for licensure will, they demand that we renew licenses annually, which is a great burden, despite the fact that the requirements for continued education are due every 2 years. So another point to consider is that added burden of having to go through the administrative task annually. But just seconding the sentiments that have been expressed by others in the public comment of including stakeholders from each of the professions and occupations, and would be great to see psychologists represented as well. And I would be happy to serve as a consultant in that capacity, and would also like to see the alerts sent out with some greater notice, at least 24 hours, if not greater. Thank you.
Thank you. Is that everyone, Lisa?
Yes, ma'am.
Okay, last call. Is there anyone in the room that has public comment to share with us today? Yes, sir.
Thank you for your time. My name is Getty Parker. I'm a master electrician in the state of Montana. The owner of Ascension Electric. We do commercial, industrial, residential, full-time service. And I will speak to my employer's words. I just would like to maybe go for each one of the committees here. I know we have the four, the healthcare, construction, but I would be more concerned with actual factual data on barriers, not just perceived barriers. Because I do not want to see our trade diminish. First, I got to think like concerned, not knowing what's going on. And I appreciate all the input from everybody here. But really just my main things I'd like the task force to focus on in each one of the committees, not just having a barriers committee, but like what is the true like barriers? The gentleman here that spoke for the Department of Corrections, I know we've worked with Fat Fellows and Workplus, worked through that in outreach to trade or cosmetology, stuff like that. I'd like to see just bring a lot of people together, not diminish each one of our licenses. And I'm not
talking about like protectionism, although it does feel a little bit like we have to. But I really just want to make sure that there's like true accurate data that people, are they qualified for one? Sometimes minimum like entrance exams are necessary to protect, the people in public. In our line of work, that's the first preamble of our National Electrical Code is to protect people and property. So, hopefully these, while they're hammer drill and the chandeliers stay up. But yeah, if anybody needs any assistance from me, anything to my knowledge. So appreciate your time.
Thank you very much. Is there any additional public comment in the room? Okay. Well, thank you all very much. First and foremost, for saying yes to serving on the task force, for what I hope will be a robust round of yeses to Erin in the coming days for your subcommittee volunteering and assignments, and for all of the work that we get to do together for the next 8 months. This does conclude our first meeting. I'm so grateful for your help. And since we took there are sandwiches in the back, but thank you so much for joining us, for committing to this together over the next 8 months. Thank you.
Thank you.
Be here.
Okay. I go back.